Hello everyone, I am Dr. Bharati Devi, Consultant Medical Pediatric and Hemato-Oncologist, CION Cancer Clinics, Visakhapatnam. Today we are going to discuss about obesity and cancer. What do we call obesity? How it is defined? Usually obesity is defined as excessive amount of the fat tissue or abnormal distribution of the fat tissue within the person. Usually there are multiple type of indices where we quantify them as underweight, normal weight or obese individuals. Among them, the most prominently that we use is the body mass index or BMI. The BMI normal range, it is 18.5 to 24.9. How do we calculate the BMI is that we take the weight and height of the patient, weight by height square, we get this BMI index. And anything below 18.5 we call them as underweight, and anything more than 24.9 we call them as overweight or obesity. The overweight category comes from BMI of 25 to 29.9. More than or equal to 30 BMI we call them as obese. There is also extreme obesity where we take the BMI as more than 35. According to the statistics in the world, 1 in every 5 individuals is having this obesity or is suffering from this obesity or obesity related symptoms also. Recent times we have seen, and there is evident data that more of the children are prone to this obesity, and also especially after the COVID-19 pandemic there is increased rate of this obesity. The obesity is known to produce multiple types of diseases. Among them the most prominently are cardiovascular diseases, diabetes mellitus, hypertension, there are sleep related problems, there are mental issues, and obesity is also producing the multiple type of cancer. According to the scientific evidence, we have data that obesity is producing 13 different types of cancers. Among them the major specific ones that we have to tell is about the endometrial cancer. There is ample amount of data that endometrial cancer is one of the major type of cancer that we see in the obese individuals. The other cancers include esophageal adenocarcinomas, hepatocellular carcinomas, renal cell carcinomas, pancreatic carcinomas, gallbladder carcinomas, colorectal cancers, multiple myelomas, and also we have thyroid cancers, and in postmenopausal female, obesity is likely to produce breast cancers also. Every year, this obesity is causing about 20% of the new cancer cases and 17% of the cancer-related deaths are occurring due to the obesity. If we go into the mechanism, how these obese individuals are developing this increased risk of cancer is that because of the increased amount of the adipose tissue, there is increased production of the estrogen. Excessive estrogen causes endometrial hyperstimulation and leading to endometrial cancer. Also, these obese individuals are at increased risk of insulin resistance, and there is increased levels of insulin and insulin-like growth factor and leptin hormone system, which is causing the increased risk of cancer in these obese individuals. These obese individuals are at increased risk of developing complications like post-treatment, post-surgery. They have increased complications like poor wound healing, wound gapping, and there will be increased time for the post-operative recovery. Also, if we give chemotherapy to these obese patients, they receive much higher doses. Their tolerance will be maybe less, and there will be increased amount of the cardiac toxicity. Wound healing will also be reduced. These obese individuals, once they develop cancer, if they don't reduce the weight, they are at increased rate of further recurrences and also likely development of secondary malignancies. How to prevent cancer in these obese patients? We will know. First and foremost is the diet. We all know that balanced diet will keep our weight under control. What is balanced diet? There should be increased quantity of the fresh fruits and vegetables and also the whole grains, and also reducing or cutting off the junk food from our diet and having adequate hydration to our body, and also physical activity, doing 30 minutes of physical activity per day will keep our weight under control, and also reducing the stress will also keep our body weight under control. If there are any morbidly obese patients or patients who are unable to reduce weight, we have evidence to show that bariatric surgery will also reduce the development of cancer in these obese patients.